is not to be interpreted as specific advice for a specific situation. Every situation is unique and requires advice to be tailored and adapted to that situation. All information in this broadcast is for educational and informational purposes only. It is not intended as a substitute for professional mental health services. If you or a loved one are experiencing mental health distress, please speak to a licensed professional in your area.
It's time to shine that light that lives in you. Living well. It's not too late to change. It's time to be the change. Living well. It's time to shine that light that lives in you. Living well. It's not too late to change. It's time to be the change.
Living Well takes a community. So remember to like and subscribe, and don't forget to share with a friend. All right, family, welcome to another episode of Living Well, where we attend to the mind, the heart, the body, and the soul. I'm your host, Dr. Erica Holmes, and I'm so happy that you've joined us because today, well, actually the next couple of episodes will be a little different from the things that we've done before. We've attended to the mind, we've attended to the heart, and we've attended to the soul. But what we haven't specifically spoken to is the body. So over the next couple of episodes, we're going to talk about the intersection between the mind and the body. It's hard to have great mental health when your physical health is declining because of lack of care. So we have a great guest for you today who's gonna talk to us about something that's known within the Black community as a silent killer. So grab a friend, call a family member, call a partner, have them watch this episode today. Hopefully it will be a reminder that we need to attend to our vessel. We need to attend to our physical health on the road to taking care of our mental health. So stay with us. All right, y'all know what time it is. It is time for the water cooler conversation. Now, what is that, you might ask? It is when we come out of our doctoral offices, gather around the water cooler and talk about things that are important for us to talk about, things that are happening, things that are hip. Can I use the word hip? Things that are now. So we like to give you some information. We're gonna show you a clip. We're gonna talk about it on the other side. Tell us what you think. Let's take a look.
We're doing our hot girl walk before our doctor's appointment. Hot girls get physicals yearly. Why I post my hot girl walks is because I have been overweight all my life, and I'm just making an effort, an attempt to remind people to move intentionally. So if you haven't walked today, get up and move around. So we all know that healthcare is a little janky in the United States. I work in the hospital, and it took me 3 months to get an appointment for my annual physical. And I had some concerns, but they're not like threatening, so I didn't make any like emergency appointments or like that. So I'm just gonna give you some tips that I have for people who are going for their annual physical. I always review medications, dosages, how I'm feeling, any symptoms that I'm having, and you report those to your physician, NP, PA, whoever. I also like to sit and review the last 6 months as far as my health is concerned. Have there been any changes, anything that I'm worried about, anything that I need to discuss with the doctor? So me personally, one big change that I had is I'm always cold now, and I'm mildly fatigued a lot. So one of the things that I want to discuss with my physician is hypothyroidism. I've always been borderline, so that's one thing that we can check during this visit. And then, of course, you need to check on the stuff that you already know you got. I have PCOS, so every time I go to my annual physical, we do like lab work to make sure that everything's okay, that I'm trending in the right direction. And then one thing that I've actually been thinking about is familial stuff. So a lot of cancer has been popping up in my family. Do I need any screenings, any annual screenings, things of that nature? So you got to get it all packed in those 40 minutes that they got for you, because you don't know when you're going to see them again. You don't.
Now tell me that wasn't a reminder. Tell me that wasn't a reminder for you all to take care of yourselves. Now, that annual physical.
Yeah, well, yes. And you know why I'm laughing, because we just had this conversation about making the appointment
exactly
for the annual physical. But it's so important. It is this. How many times do we overlook it? We just think, oh, it's just an annual physical. If there's nothing really major ailing us, you know, we'll just dismiss it. But it is important, especially, she said it took her 3 months and she works in the medical field. Like in her office, it took 3 months. Jeez.
But that tells you about the state of healthcare.
Exactly.
And also why so many of us, those in our community, may not be as aggressive or, as motivated to seek medical attention, sometimes because of the way that we're treated when we go. But I think it's important for us to take advocates with us, to advocate for ourselves, to have others to advocate for us. And one of the things that you mentioned when we started, we did have this conversation about, have you run your annual physical? Have you done your mammogram? Have you done your grown woman exam? We had those conversations, all these appointments, and we agreed to be each other's accountability partner.
Absolutely.
We said, okay, when we see you this time in 2 days, I need to make sure that you've made your appointments. And we agreed to that. And I'm so thankful for that. It highlights the importance of having people in your life who can hold you accountable for a lot of things, even making sure your physical health is on track.
Absolutely. And because, like I just said, sometimes, how many times do we say we're going to sit down, make the call, and we don't, and we look up, it's 6 months later, or worse than that, we're experiencing some kind of pain because we're not really listening to our bodies and we're dismissing it. And then next thing you know, now we have to be in the doctor's office. And I think that happens more times than not. And, there's so many other things that we just as a people, as a community can do to really stay on top of our mental health.
I think it happens more times than people want to admit.
I think so.
And there's so many things that if we catch early can be treated with a minor intervention.
Right.
But when we let it roll on, now we might be facing more invasive, more severe procedures or treatments. So it's important, we've talked over 30 some of our episodes about the importance of mental wellness, relationships and all of that. This is the first time we're talking about take care of yourself physically. Take care of your body. This is your vessel God has given to you, and you have the responsibility of caring for this vessel. One of the things that you also mentioned was something's not major, so we're like, oh, just forget it. We'll often overlook, as the young lady was talking, she even mentioned, I get cold. So I want to check on X, Y, and Z. Or she's thinking about what's happening within her family, the illnesses that are popping up in her family. So she's like, I also want to talk to my doctor about that. This idea of being proactive, being mindful of your body. We can't remember everything because we're often running from to to fro. We have so many things that we have to deal with. Make a note in your phone, list of new things. Might not be much of anything. The doctor might say, oh, that's normal. That happens sometimes. Or they might say, let's test you for this or that. Or you might have to say, I'm feeling this way. Maybe we can test my, as she mentioned, my thyroid, right? Or maybe am I anemic? Or what a lot of darker skinned Black folks are deficient in, is that vitamin D or something like that because of the sun? I think it's because we don't get enough sun rays. Don't quote me. I'm not a medical doctor.
Yeah, we're doctor of psychology, not doctor of medicine.
But there's something that darker skinned Black folks are often a vitamin they're deficient in because of the lack of access to sun rays and what sun gives us. So sometimes we have to take supplements. So there are a lot of things that you can educate yourself on, but the important thing is to be proactive about your health.
Yeah, that's important. And I also like what she said, because this is something that we hardly ever do. She said she'll go back and take an inventory of her health over the past 6 months.
Yes.
And I think that is really important. Like you said, let's just put it in the phone when you take, your fingertips always feeling like they're cold and numb is not something normal.
It's
not normal. But when you have gone back and assessed it over the past 6 months and you realize, well, wait a minute, this is happening more times than not. And that information is helpful. Why? Because when you then report it to the doctor, one of the questions might be, how long have you been feeling that way? So, little things like that. You're right. We have to be very proactive about our health. And when it comes to our physical and mental health as well, let's be proactive so that we don't have to be reactive.
Yes.
And that's the part that's important. I don't want to be treated. If I can prevent it, then that's fine. Give me some vitamins.
Yes.
Give me a small prescription.
Yes.
Give me an exercise regimen, something that I might need to engage in, as opposed to the much more serious medications that I'll have to rely on.
Yes. So what we want you to do right now, we want you to type in the chat and put a reminder on your phone. that you are committed to taking care of your physical health, that you'll do one thing this week, whether it's make an appointment, follow up with the doctor, take your medications consistently. You'll do one thing this week to make sure that your health is on track and you're moving forward. So that's what we want you to do as we get ready to transition into our next segment. We have a great guest, Miss Danette Baptiste, who will join us and talk about the importance of overall health, including your physical health. So stay tuned. Welcome back, family. I told you that we had a treat in store with you today. Now, of course, as I said in the opening, we're doing something a little different. You know, Living Well, we attend to the mind, the heart, the body, and the soul. Well, this is actually our first episode really attending to the body. Although every other aspect is impacted, we're going to attend to the body. So I want to welcome for the first time to the Living Well stage, Miss Danette Baptiste, who is joining us, and she's going to help us to think about how we care for our body, what we do for our body, and the importance of taking care of ourselves from the inside out. So thank you so much for joining us.
Thank you so much for having me. I'm so privileged to be here today.
We're excited. I was so excited to meet you. And just to let you all know, I met Danette at the cardiovascular event that we had here at Faithful Central. I think it was the beginning of March.
Yes.
It was in the beginning of March 2024. And you were here along with someone who's very special to you, helping to do cardio exams, having people getting like echocardiograms, and don't get me to talk about medicine, of the heart, and seeing how everything worked. And we got to talking, and you began to talk about your organization. And I thought this would be great to talk about on Living Well.
Yes. Thank you so much. Well, I am Danette Baptiste, and I am the executive director and CEO of Healthy Heart Nation. And so Healthy Heart Nation was started by my husband, who is a cardiologist and is really focused on the heart. And so I bring a business background. And so when we were looking at the organization, for me, I looked at it and I said, well, it's one-dimensional. And if we're really going to service our community, we need to have more dimensions. And so the Healthy Heart Nation, healthy is what we want our community to be. Heart is really about the passion that each of us has in our own lives and how we're able to share that with others. And so the nation is who we're able to serve by using those three principles to serve the community. And so Healthy Heart Nation is focused on health. We're focused on business. We're focused on education, and we're focused on justice. And so we consider those the four legs of the table. And on top of that table are community initiatives. And so we feel that it's really important for us as a community to really support one another in various areas and not just look at it myopically. So not just look at it from a lens of health, but if we're doing a project, we bring our business people in to say, okay, how do we make what we're doing sustainable? How do we create the processes that are repeatable and that we can make sure that we have the outcomes that we're looking for that are going to be wide-ranging. We look at justice side, right? Legal pieces. What are the risks that we need to look at? What are the contracts that we need to have in place to ensure that we mitigate any type of risk? And then from an educational standpoint, how can we learn from what we're doing to make sure that we are, providing educational information to people so that we're not just touching them once, they have the ability to be touched throughout. And so that is who Healthy Heart Nation is. And those are the things that we are focused on, really looking to the Black community to support the Black community. Like, we're not looking for someone else to save us, although we need partnerships, we need collaborations. But, a lot of times, and you sit around the table with your girlfriends and with your friends and you're like, the example is not about who you're married to, who you had a baby by, all those kind of things. But that's what the media is saying is the Black woman, is the Black community. And how can we complain about it if we're not trying to show them something different? different.
Right.
And so that's really about, the things that we do. We have mentoring, we have financial literacy, we have, health initiatives, we have seminars to help people get into college, we do HBCU scholarships. So we really just try to touch on the passions of all the 150 ambassadors that we have in the U.S. and Canada to bring those passions to play, and then for us to elevate and illuminate those passions through the people in the organization.
Oh, wow.
Wow, that, just hearing it, it is so much. I mean, there are so many different areas that you're hitting, and just to even hear you speak with such passion about it, to see how you're making such an impact. How did you even get started in this work?
You know what? You get started by just doing and listening to the voice, and that voice is the voice of God, many sleepless nights, I'm sure you all have had that where it's put in your heart. And for some reason, it always happens in the middle of the night when you're trying to sleep, right?
Yes.
And you can't sleep. And so, when we first kind of got it started, it was just such a passion project. And so we just started to look at, where can we be of support? And so with my husband, being the cardiologist, and we were just talking about how do we make an impact. And so one of the projects that we're very proud of and we're doing a lot is our pressure project. And so the pressure project is really focused on, bringing pressure awareness to the community through churches, barbershops, and beauty salons. And it is really about meeting people where they are, right? And so there's some people that are in the church that, in the barbershop that are never going to go to the church. And so how do we serve the community if we're waiting for the community to come to us?
Right.
That's not necessarily service, right? So we go in on a weekend, and we set up shop. We provide blood pressure awareness. We take their blood pressure. We give them education on what their numbers are, as well as things that they can do to improve their numbers. And to let them know that, listen, if your numbers are, high, stage 1, stage 2, stage 3, you need to understand that. So what we share with them is that a blood pressure is almost like a snapshot, right? So you take a picture of us right now, but then you take a picture of us at the end of the day, it may look different, right? And so what we want them to know is to understand what is your normal number. First of all, what should your number be? So normal is 120, less than 120 and less than 80 in the systolic and the diastolic. So we share that with people and we talk to them just like this. It's very different when you're sitting down, with them and you're explaining it to them versus if you're explaining it to them in group or they're in the hospital where they feel like they're being rushed. And so we let them know, okay, these are good numbers. Your number is good. Your number is stage 1, 2, or 3. You should be concerned, right? You need to make sure that you check it again, and or we give them the information that they need to go talk to their doctors and have the conversation, right? So a lot of times when we're having the conversations in the doctor's office, we're coming from a point of, we're afraid. We don't feel like we have the language or the words to have the conversation in the first place. And so part of the project is giving them the awareness to have that conversation. So, okay, this is the number that I got. I'm concerned with it. What can we do to correct it? And so, it's really about that. And we want to be able to normalize the conversations. And so, as a result of the project, we do the barbers. We take their blood pressure numbers. And one of the instances, one of the barbers, we took his numbers on the first day that we set up the project with him. And his numbers were high. And so he told his wife what his numbers were. Later on that same evening, he started to feel symptomatic. And he had been feeling those symptoms before. But because he had the information that we shared with him, he realized that it was more serious than not. And his wife took him directly to the hospital. He ended up having to get a pacemaker. And he was like, this project saved my life. So that barber, when he's cutting people's hair, he's not just asking them, what was the score for the game, but he's like, do you know your numbers? Are you aware that this can kill you? Right? And so it's really making those impactful discussions in a place where it matters, right? So for the Black community, relationships are everything.
Yes.
Right? So you could be, a doctor, you could be a world-renowned surgeon. I'm gonna listen to my beautician, right? Like, when she says something is, I'm listening to her a little bit different because you've built that relationship, you have that trust. And so, part of what we're doing is really ensuring that we have that trust in the community. And so it's not like you're doing a health fair where you're there once and they don't see you again.
Right.
So we're consistently there once a month at the same places. So we're seeing sometimes the same people.
Right.
And so that's really where, the service comes in. We utilize high school students. We teach them how to do it. We utilize retirees. And we also utilize nursing students, medical students who are looking to get, certain hours.
Right.
And so it's a community effort. And so when people come in and they see, that, the love, the fun, right? Because you're still having fun. It just really, it's very impactful.
You all are doing a lot of work and necessary work. I'm just blown away, hearing this for the first time. I would love to talk about specifically, why is it important to know your numbers? Why is it important to have your blood pressure, checked? I'll just, disclose, like, I remember years ago, my mother was like maybe 43 or so, and I obviously had been dealing with high blood pressure that she didn't know or acknowledge. And she found out because she passed out in the choir stand one Sunday.
Yes.
And then they called the paramedics, they took her, and her blood pressure, I don't know what the number was, but it was high. And so that's how she discovered that she had hypertension. So why is it important to know your numbers? And I know you're not a medical doctor, but you're married to one.
Right,
exactly. But you're married to one. But what are some of the risks if people don't know what those numbers are and intervene at 1, 2, or 3? Like, what are some of the risks?
Absolutely. So a couple of things of what you said. And for me, I believe in like the Pygmalion effect. And so what that really is that people rise to the level of their expectation, right? And so a lot of times in our community, we have a lower expectation. Even sometimes when you go to doctors and your numbers are high, they say, oh, that's okay because, your community has high numbers. And it's sometimes dismissed, right? But what we want to do is to change that expectation on a personal level through relationships and let them know what is normal. And again, normal is less than 120 and less than 80. That's where you're trying to get to. Right? So wherever you fall on the scale, if you're not within that range, then you've got to do something to change it. Okay? And so that's kind of part of what we do. We really want them to understand and have the awareness, right? So you can't change something if you don't know that something's wrong. It shouldn't have taken your mother passing out, to understand that her pressure was high, right? Through her, through her visits, to the doctor or whatever. This is something that we should ask them, because a lot of times you go in, they take your numbers and they write it down. Do they even share it with you, right? So you want to know that. You want them to know that information. So there's normal, which is, less than 120 over 80. Elevated is considered 129 to 139 and over 80. And then 140 to 150 is stage 2. And then you've got the hypertension stage 3. And those numbers, we unfortunately see them way more than we want to, even in these settings. And a lot of times we talk to the person, oh, I didn't take my blood pressure medicine this day. I know I have high blood pressure. I know it's going to be high. But the secondary question is, well, what are you doing about it? Because there's so much in our lives that we can't control. Right. We can't control the weather. We can't control the traffic. But you can control your blood pressure. And so there are things that you can do, whether it's high to the point where you are on medication. That does not have to be forever, right? So sometimes you have to stabilize it, and then you do lifestyle interventions that can improve it. So we talk to people about the simple things like water, like hydration. Like, we're running all day long, but like, if you really think about it, are you really hydrated, right? Are you really getting the water intake that you need? A lot of times you don't want to stop because you don't want to go to the bathroom, but it's very important to stay hydrated. That will affect your numbers in a positive way. Your sleep, right? Like, it's so easy to say, just get rest, but your sleep really does affect your numbers in a positive way. So if you're getting sleep, you're allowing your body to rest. You're allowing your mind, which is always active, but it slows down a bit when you're sleeping, right? And so it's really important to get your sleep. Exercise is another thing that can change it and affect it. And we talk about, it's not about going to the gym and pumping out iron for 2 hours. It's about walking. It's about being active. It's about, if you're going to the grocery store, are you parking closer to the door, or are you parking a little bit further away? Like, these are just little things that you can do that will, improve your day-to-day life, right? Taking the stairs, and just moving, right? And so those are some of the things that you do. Your stress level, right? And, we know as women of God that, there's fear and then there's faith. Right? So you have to pick one or the other. You can't do them both, right? And so our stress level, and not that we don't have things to be concerned about or worried about, but you're, at the end of the day, you're either going to give it to him or you're going to take it yourself.
Right.
And so if you give it to him, that's expressing your faith. And he says, cast your burden on me because, my burden is light. I'm going to lighten your load, right?
That's right.
So those are the things that we try to just encourage. And these are things that we know. But again, awareness is the difference between knowing and doing. Right. And so it's about really just repeating these things, reminding each other of these things in those moments where you need to hear it most, from people who care about you, who love you. And so that's really kind of what, the things that we encourage people to know.
Right. It's so funny, as I sit and I'm listening to you talking, there's a question that come up and then you go right into it and you answer it. And I'm like, but I so appreciate what you said, that at the bottom line is about the awareness.
Yes.
And so many people are walking around, like we just said, having absolutely no idea. And I think more than anything, I love this idea of meeting the people where they are, because many people may not have access to all these different spaces and different, circles, but there are people walking around whose lives are really, literally in danger.
Yes.
You talked about key things like, at least knowing what your blood pressure is when you go to the doctor, so that you can understand how to have a conversation. You talked about how important it is to hydrate and get our sleep. I'm also wondering, for the person, just the average person that's sitting at home watching TV, and now they're beginning to think about, oh, maybe I should pay attention. Is there anything else that you think that is really significant, that's really important for just people just to know in general?
Yeah, you have to listen to your body, right? And so, just recently, Dr. Dre had several aneurysms and several strokes, right? And so this is a man who is a billionaire.
Right.
You would assume that he has access to the best care, but there is, unfortunately, a stigma for the Black community that, regardless of your money and your financials, sometimes they still don't look at us and give us what we need, right? And so at the end of the day, we have to be able to do it. But I was concerned when I, listened to, and read, his situation, that he said he had no idea that he had blood pressure, that he had high blood pressure. And so, he had about 3 strokes, aneurysm, and I'm like, if money can't insulate you, in these situations, the power lies in each individual person doing for themselves, right? And so, again, like the awareness, if they're sitting home and they don't really know it, you can go to a CVS, right? They have the machines there. It is really about being active and taking an active role in your health, because at the end of the day, it's your responsibility. It's your responsibility. We can, you can take a horse to the water, but you can't make him drink, right? But you really have to understand that it is your responsibility, that you are of value. And you have to put value on yourself if you're really going to be able to benefit other people, right? And so it's very important. And a lot of times we're just ripping and we're running. And I don't think any other race uses ripping and running.
Right.
That's just the whole, that's just us. We ripping and we running, right?
And everybody knows what that means.
Exactly what that means. But we got to slow down. We got to take take time to just take a breath, see our value, see our worth, understand that when we put the oxygen mask on ourselves, we can touch other people. We can help other people. We can make an impact on other people. And so, it's just the awareness. It is the value that you put on yourself. You will have to make time, but we make time for everything that we feel is of value.
Right.
So they're all kind of connected. And so we really want to connect the dots. One, through the Healthy Heart Nation, when we're out in the community, we're telling the community that they are of value to us.
Right.
So, you're of value to us. Are you of value to yourself?
Yeah.
And so those are kind of the things that, that we're really wanting people to understand.
Yeah.
And just, it's not hard.
Right.
Right?
Yeah.
But it's going to take effort.
Right.
Yes, yes.
Right. And effort is so important because we can't reach a goal without effort.
No.
Right.
Right.
Another thing that I would also say, and I found in talking to people and that I also encourage people to do, is if you know that you are shy or hesitant or were raised not to kind of question authority, take an advocate with you to the doctor.
Yes, so important.
One first step could be writing down each of the questions that you want answered, so that you're not in there trying to remember what was it.
Yes.
Use your cell phone, take a piece of paper, write it down, but also take an advocate.
Absolutely.
You have a big mouth friend or a big mouth adult child who's not afraid to speak truth to someone who is in authority.
Yes.
Take an advocate and say, to say, what, my friend been having headaches or what, that's a good thing. What are some of the signs that, like you said, Dr. Dre missed? That just came up.
Yeah.
We didn't talk about what are some of the signs. I know it's also called a silent killer.
It is.
Sometimes there's not signs or symptoms.
There isn't for
so
high
can you
blood
talk about
pressure.
that a little bit?
Yeah, absolutely. And for like the aneurysms, like it is an excruciating headache, like the worst headache that you've ever had. And if you're having it consistently, then there's something to watch. And we've all had headaches, right? I've even had migraines, but like they say, it's a pain worse than even that. When your blood pressure is high, a lot of people feel like, oh, I can tell my blood pressure's high, right? I don't know if that's a thing, right? But so it's one of those things where you would have to like actually take your blood pressure to really understand it. Your heart rate sometimes, can be higher if your blood pressure's high. But it is really as simple as really you need to take it to really know that you're having problems. And so again, on that whole advocate thing, like, I am married to a doctor, but nonetheless, when I go into a doctor's office, it's intimidating,
Right.
And if you're in pain or you're suffering through something, you're less vocal than you would be otherwise, right? And like you said, I would probably be more of an advocate for him if I was in there with him than I am for myself.
Yes.
And so again, it is not silly, it is not whatever to do that, because in most instances, if you're going to the doctor, especially if you have an issue, you're scared.
Right.
Fear and faith, right. But there's, you're afraid, one, to find out what it could be.
Right.
And two, how you might have to respond if there is something wrong. Right. So like everything that you said is important. Write them down.
Yes.
Get some questions. My girlfriend, she's on the internet all night long, doing her own doctorate, she's got her long list of questions. But again, it is really important to have somebody else there, because sometimes you can't even hear what they're saying. Right? So if you have someone there that can either transcribe it, that can record it, or for your behalf, because at the end of the day, the goal is to not be there.
Right.
So get there so you don't have to be there.
Right.
And so all of those things are really important.
Yeah. I love that. I'm hearing that one thing that we know, particularly for the African American community, is the importance of advocacy.
Yes.
Particularly when it comes to, our medical health, when we go into the doctors. Because so many of us, when we go and see the doctor, yes, they have the doctor, they're looked upon as the expert.
Right.
But more times than not, we're often dismissed as well.
Yes.
And so what I'm hearing you say is that we still have a right as well as a responsibility
Yes.
to be able to advocate for our own
Absolutely.
health.
Absolutely.
And not to be overlooked when we say we have a headache. Don't give me
Yes.
no aspirin and send me
Right.
home. I just
Right.
told you I have the worst
Yes.
headache I've ever had in my
Yes.
life.
Yes.
And so the message is, it's important for us to know that we're able to do that. We need to do that.
We have to.
Yes, we have to
Yes,
do it.
we
So
have
the
to.
advocacy is really important.
We have to. And we're not usually short of help.
Right.
Right? Like you said, if it's a if it's a child, if it's a parent, if it's a friend,
Yeah.
and we've got to be able to do that. That is part of the strength of us.
Yes.
It's our community, and it's about having that support system.
Right.
So don't feel like, oh, I don't want to bother you.
Right.
I mean, I'm telling you, I need people to go in with me
Yes.
because I absolutely hate going.
Right.
And so if I'm in there, I'm deer in the headlights. And so it's very important that you advocate. And if you can't do it for yourself, bring someone else to do
Bring
it.
someone else.
Yes.
I love it. And we could talk all day, morning and all day long, because I'm quite sure, as we know, hypertension and diabetes are two, and heart disease are
disease.
three
Yes.
major medical diagnoses that are extremely high in the Black
Absolutely.
community.
It
And
is.
so knowing your numbers,
Yes.
hypertension impacts the heart. Diabetes impact the heart. Cardiovascular disease is the heart being impacted.
Yes.
So, knowing our numbers, urging people to go to the doctor,
Yes.
do your
Yes.
annual physical, go to
Yes.
CVS, buy a blood pressure machine.
Yes. Yes.
Check your own blood pressure, because it is linked to so many other
is.
health conditions.
Yes.
So we need to know our numbers. We really
Absolutely.
appreciate you being here.
Thank you.
Tell us, how can the people find you, find out more about Healthy Heart Nation?
Yes, well, our website is myHHN, which stands for myhealthyheartnation.org, and you can find information on our website there. You can also look to see what we're doing next. And if you're interested in us bringing the Pressure Project to you, whether it's a barbershop or a church or a beauty salon, you can reach out to us through our contact there, and we are here to support you. And we're also always looking for volunteers. So retired nurses, if you are nursing, if you want to impact your community, please reach out to us because we could use some help. We're currently in Atlanta. We're in Huntsville, Alabama. We're looking to branch out in Chicago, the DMV area, and Texas and Florida. So, it's really about getting involved, and touching as many lives as possible through people who care.
That is amazing.
Yeah.
Thank you so much, Danette, for being with us.
having me.
This was exciting. And
Yes.
again, this is our inaugural session on doing something for the body.
Yes.
I love it. I love it. And it's so important. So thank you so much. Thank you all for tuning in. We pray that you've learned something, that you've been inspired to check your numbers, and to also hold your family and your friends and others in the community accountable. Ask people throughout the day. Text somebody right now and ask them, do you know your blood pressure numbers? So keep your friends accountable. We pray that this has touched you in some way. You have a resource here. Tell them the website again.
It is www.myhhn.org.
You have a resource there. We always like to leave you with something so that you can follow up. This was our conversation for today. Until we see you again, we pray that you are living well. For more information and resources, be sure to check us out at normalizehelp.org. And you can always email us at livingwell@faithfamily.org to get a question answered or to tell us a story. You never know, your question might make it to air or be the subject of one of our episodes. See you next week.
It's not too late to change, it's time to be the change. It's time to shine that light that lives in you. It's not too late to change, now it's time to change. Now it's time to change, now it's time to change. Now it's time to change, time to change, time to change.